Let's review some practice questions in relation to integumentary content within pediatrics. As with all of our practice question videos, I do ask that you pause the video after we initially review the question and the answer options. That way you can use your own knowledge base to come to the correct answer, and then you can resume the video for us to review that answer and the rationale together. All right, highlight in text physiological integrity. The nurse is performing an initial assessment of a 7-year-old pediatric patient who presents to the outpatient clinic with his mother with complaints of a rash. The nurse notes the following. So the patient does report a trip to visit his family out of state 3 weeks ago. He's got a past medical history of a COVID-19 and a break in the right arm. He's got a pruritic rash in between the webs of his fingers and toes. The nurse notes fine grayish red lines, and there's reports of a similar rash on family members that live in the same home. So highlight the findings that are of concern to the nurse. All right, so the nurse, based on the information that we have, the nurse would suspect scabies based on the findings of fine grayish red lines, which can represent the burrows of the scabies, the rash in between the webs of the fingers and the toes, and then also the reports of similar rash on other family members within the same home. All right, classic multiple choice physiological integrity. The nurse is performing an assessment of a 15-year-old female who presents to the outpatient pediatrician's office in July with complaints of a rash on her face and neck. Upon physical exam, the nurse notes honey-colored crust around the patient's mouth with ulcerated bases. The nurse determines that the patient is presenting with which of the following. So there's a key assessment finding here, honey-colored crust with ulcerated bases. So when you see that honey-colored crust, you should automatically associate it with a specific disease process. Is that impetigo, pediculosis capitis, eczema, scabies, or dermatitis? The correct answer is impetigo. So impetigo is a contagious bacterial infection of the skin. It's more prominent during hot, humid months. Common sites of infection include the face, mouth, neck, and the extremities. And again, honey-colored crust are characteristic of impetigo. All right, a multiple response, select all that apply, physiological integrity. The nurse is caring for a pediatric patient on the burn unit. Which of the following assessment measures will the nurse utilize to determine the adequacy of fluid resuscitation? Select all that apply. So you have a pediatric patient on a burn unit. They're getting fluid resuscitation. Which assessment findings are you going to look for to determine the adequacy of that fluid resuscitation? All right, so the correct answers are capillary refill, heart rate, volume of urine output, and mentation. So parameters including vital signs, especially the heart rate, urine output volume, adequacy of capillary filling, and then the mentation, the state of confusion, orientation of the patient determines the adequacy of fluid volume resuscitation. The others will also provide information about fluid resuscitation, but they are not priority assessment measures. All right, we have a classic multiple choice physiological integrity. A 7-year-old female patient presents to her pediatrician with complaints of scalp itching. Upon exam, the pediatrician notes the presence of small, whitish brown insects moving on her hair and scalp, as well as small white eggs attached to hair shafts. The diagnosis of head lice infestation is made. Which of the following statements are true regarding head lice infestation in pediatric patients? So you have a patient with lice. Read these followings, which are true regarding lice in the pediatric population. All right, so lice can be transmitted through sharing personal items such as hats or combs. Symptoms of lice include that scalp itching, and then, of course, visibly seeing the lice or the presence of nits on hair shafts. Treatment of lice includes an over-the-counter or prescription shampoos which contain pyrethrins or permethrin. Family members in close contact should also be checked for lice and treated if necessary because they can spread very quickly within a household. Right, classic multiple choice physiological integrity. A 3-year-old child is admitted to the emergency department with burns on the face, neck, and chest after pulling a pot of boiling water off the stove. The nurse assesses the child's airway and breathing and administers 100% oxygen via non-rebreather mask as needed. What is the priority nursing intervention for this child? So, what is the priority nursing intervention? Is it going to be to initiate IV access for for fluid resuscitation, administer IV analgesics for pain management, assess the child's level of consciousness and responsiveness, or placing the child in a cool water bath to reduce the risk of further tissue damage? So, what is the priority nursing intervention right now? All right, so the correct answer is to initiate IV access for fluid resuscitation. So the priority nursing intervention for a child with burns, especially those involving the face, neck, and chest, is to initiate IV access for fluid resuscitation. Burn injuries can, of course, result in fluid and electrolyte imbalances. This includes hypovolemia and shock. Prompt fluid replacement is essential to prevent further tissue damage and to improve the patient's outcomes. Administering IV analgesics is important, but it does not take precedence over fluid resuscitation. Again, assessing the child's level of consciousness and responsiveness is also important, but in this case, fluid resuscitation is the primary intervention.